It is my pleasure to welcome and introduce our speaker, Dr. Jane Van Dijk, Assistant Professor OBGYN at the University of Rochester. She lectures nationally and internationally on the intersection of the climate and plastic crisis and maternal health. She co-founded OBGYNs for Sustainable Future, an interest group of healthcare without harm. Dr. Van Dijk has published academic journals on the climate crisis and women's health. Thank you so much.
Thank you, and excited to be with you. I went to medical school in South Dakota, so we sometimes would go down to Nebraska for big city life. But I am going to talk to you this morning, and I'm going to move through my slides rather quickly. So put your seatbelts on, but definitely save your questions for the end, and I'm happy to address them as there's a lot of information here. I have my objectives here. We are going to talk about how fossil fuel driven climate change and plastics affect human health, specifically maternal health. We'll talk about the different types of plastics, look at how we might take an environmental history regarding plastics, how to avoid some of these plastics and endocrine disrupting chemicals, and how to decarbonize a hospital and OBGYN practice. I have no financial disclosures or conflicts of interest. And I always put this slide up first just to remind us that fossil fuels, oil, natural gas, and coal obviously have their same source as all of the plastics that surround us. And so as we are transitioning into renewables and decreasing our use of fossil fuels to heat and transport us, the companies that make these products are planning on increasing by a large amount, 3 times as much plastic in the next 20 years as is currently being produced. So I just want to put that algorithm in there. I actually moved from California to New York 4 years ago, and I lived here in Altadena, where my neighborhood is now gone due to the climate-fueled wildfires that happened in January. As we think about some of the slides that I'm about to show you, one of the comments that I've gotten at the end of the grand rounds is that despite spending years on this and writing papers about it, that I'm somehow confusing correlation with causation. And what I would say is that I will not tell you that plastics and endocrine disrupting chemicals are causing preterm birth and sclerotic plaques to be worse, Alzheimer's to be more prevalent in those with higher amounts of plastic in their brains. But what I will say is that hopefully after you listen to my talk, you might think that there is sufficient harm from these chemicals that we should be acting, and not necessarily entirely just individual people, but as a society, that we should be protecting our health from these chemicals. And I list some of the chemicals on the left-hand side where we did not also have necessarily causation studies, and yet we were able to act in order to protect public health. So why did I get into talking about this? I'm a full-time OBGYN. I'm an OB hospitalist. I work 60 to 80 hours clinically a week. Well, it's because I saw more and more of my patients getting hypertensive disorders of pregnancy. When I trained 22 years ago, preeclampsia happened, absolutely, but it was much, much rarer than what I see now. I have times when everyone on my service has some variant of hypertensive disorder, whether it's chronic gestational hypertension or preeclampsia, and the data bears that out. Pregnancy-associated hypertensive disorders are going up on average around 2% per year. As we know, also other chronic diseases going up, obesity and diabetes as well. And so you'll see those sort of market increases in the last 20 years. I'm not an oncologist, but I do think it's important to point out that more and more people are talking about how we're seeing more and more young people, those in their 20s and 30s, being diagnosed with cancer, and they're in every article that you read, they will say there's the potential for environmental exposures being the cause of this. This is just a graph showing you how chronic disease has gone up over between 1990 and 2000. And then a little bit about emissions from healthcare. So U.S. healthcare is responsible for somewhere between 8 to 10% of all U.S. greenhouse gases. That is huge. Aviation is only 2.5 or 4%. So we are nearly 4 times that of one of the transportation sectors. We're 4% of the global population, but we emit 27% of the world's healthcare greenhouse gases. And then in terms of plastic, 30% of daily hospital waste is plastic, and that adds up to 2 million tons of plastic waste per year. And plastic production and disposal is around 5% of total greenhouse gas emissions. Chemical pollution is estimated to cause somewhere between 2 million deaths per year, and we could play an essential role in abating some of these statistics. This is a fascinating study done by Leo Trasande down at NYU. And what he did was he tried to do an attribution study to determine how much our exposure to plastics and the chemicals in them are causing U.S. healthcare. And so in 2018, he estimated around $250 billion. So let's focus our attention now solely to maternal health and the climate crisis, and then after that, we'll transition over into plastics. So we will likely pass through 2C in the late 2020s. Right now, we're at like 1.62, 1.65, and 2024 was the hottest year on Earth. Importantly, women and girls are 14 times more likely to die in a climate disaster than men. It's one of the ways in which climate change is gendered. And if we were to put pregnant women up there, that would be even greater because they are more vulnerable due to the physiologic changes of pregnancy. This is a meta-analysis, so 130 studies showing that women and girls more likely to die in heat waves and suffer from more food insecurity in climate crises. Importantly, every 1.8 degree Fahrenheit rise over average mean, there's an 8% rise in physical violence and a 7.3% rise in sexual violence. And then I just came across this study the other day coming out of England, showing that male violence against women increases 47% after soccer matches. And I read this on the same day that the gentleman rammed his car into a crowd of people in Liverpool after a soccer match. We know that heat waves also increase the risk of femicide and domestic violence as well. In Kenya, girls are sold into marriage to stave off starvation from drought. So girls and women globally are going to be more vulnerable and suffer more due to climate change. So women, girls, and pregnant women more vulnerable to the climate crisis. So let's talk a little bit now specifically about pregnant women. So pregnant women are more susceptible to some of the physiologic changes of pregnancy. As we know, they have increased oxygen consumption, minute ventilation, they have increased cardiac output, which increases their susceptibility to hypertension, as well as increased rates of dehydration. And some of this is coming from increased fat deposition, as well as the thermogenesis from the fetus. And so we have some meta-analyses showing, review studies showing that maternal heat exposure is associated with both preterm birth, low birth weight, and stillbirth in over 70 studies. And we see, unfortunately, a discrepancy sometimes between more suburban or rural areas versus urban, where there's more concrete and more asphalt, where there can be up to a 20 degree Fahrenheit difference in heat. And so some researchers suggested for every 1.8 Fahrenheit rise over max mean, there's a 5% increased rise in stillbirth and preterm birth. This was a study in JAMA from 2023, looking at heat exposure in the third trimester and showing that those who had exposure to a heat wave in the third trimester had increased rates of hypertensive disorders, cardiovascular events, and cerebrovascular events. In addition, we know, and Nebraska has a lot of farm workers as well, that in any given day, the study showed that 33% or a third of workers had kidney injury due to heat indexes that were high in the middle of summer. This was a fascinating study out of Bangladesh, and what they showed was that as the seas are rising, we should expect that there'll be increased saltwater incursion into water tables for drinking. And as that occurs, we should also then expect that maybe there will be increased rates of hypertension in populations where there is increased salinity in their groundwater. We also are seeing increased rates of dengue fever, especially in the southeast United States. And then we've also started being able to track some malaria cases, not from travelers who are returning from places where malaria is endemic, but rather from mosquitoes here in the United States. This was a fascinating study after Hurricane Harvey in Houston. And as you know, that flood lasted for a lot of days. That storm just sat there and rained and rained and rained. And as it did so, because Houston is responsible for manufacturing about 42% of petrochemicals for the United States, some of those petrochemicals were able to also get into the groundwater and pollute it. And so what these researchers showed was that there was an increased maternal and neonatal morbidity the closer a woman lived to those manufacturing facilities. This was a great meta-analysis also in JAMA, 32 million births, showing that exposure to particulate matter, PM2.5, from fossil fuel-driven air pollution increased the rates of preterm birth and low birth weight. And then for those near fracking, I don't know how much fracking occurs in Nebraska, but in Pennsylvania, which is next to me, there is a lot of fracking, and pregnant women living near natural gas wells are more likely to deliver low birth weight babies, as well as increased rates of birth defects, as well as premature death for those living in those areas. And then also infertility, we see in a dose response like curve, the closer a woman lives to a major throughway, a major freeway, that air pollution affects her ability to both become pregnant and stay pregnant. So those who are at increased exposure to air pollution have increased rates of failure to conceive as well as miscarriage. And then wildfires, more of a West Coast problem, but obviously we see that smoke can travel anywhere. Pregnant women exposed to wildfire smoke for at least one day faced a higher risk of giving birth prematurely. And we have some great review studies with millions of births to bear those numbers out. And that wildfire smoke, like the air pollution PM2.5, is causing systemic inflammation. It's increasing risk for cardiovascular disease, respiratory disease, as well as oxidative stress and cytokine release in the nervous system as well. And so for those who might be wondering, how can I help my patients in natural disasters, in climate disasters, the American College of OBGYN published a committee statement in January of 2025 this year. And so they talk about how those of us caring for pregnant women in an ecological or natural disaster can basically prep our patients so that if something were to happen, like Hurricane Harvey, like the wildfires in January, that our patients have a plan in place if they're affected by that natural disaster during their pregnancy. So in summary, heat, air pollution, wildfires, hurricanes, flooding, all put pregnant women at increased risk. And now let's turn our attention to plastics. So still driven by fossil fuels, but a very different type of pollution. So The Federation of International Gynecologic and Obstetricians said every pregnant woman in the US has at least 43 different environmental chemicals in her body, and to a disturbing extent, our babies are being born pre-polluted. There is now 2 times as much plastic as living biomass in the world, so it's no wonder we're finding plastic in every corner of our bodies. Global plastics production is in a parabolic curve in terms of its increase. And the most important thing about plastics is definitely the particles, the individual particles of micro or nanoplastics. But really, what we think is deleterious or most deleterious is, in fact, the chemicals inside the plastics. So the plastic or the petrochemical industry is 20% of US GDP. That's around a little bit more than what healthcare is. Healthcare is somewhere like around 16% of US GDP. And if you think about it, those who are making the most money obviously also have the ability to influence the legislators. And I want you to think about that as we talk about these chemicals, because there's a reason that they're not regulated. And there's a reason that they're allowed to be out in the public where 10,000 of these chemicals have no safety data behind them. So briefly, I'm going to go through the 7 different types of plastics so you kind of have a frame of reference for the types of exposures that we're talking about. So number 1, polyethylene tetraphthalate. These are all of our water bottles and polyester. So those of us working in healthcare oftentimes have 100% polyester scrubs. This is plastic number 1. Number 2 is high density polyethylene. So these are going to be like your laundry jugs or thicker, harder plastics. Polyvinyl chloride. This plastic is in everywhere. It's in our flooring, it's in our furniture, it's in our walls, it's in our wire and cables. Basically, you know, ubiquitous throughout our industrialized lives. Low density polyethylene, or number 4. These are oftentimes in food packaging, a little bit thinner plastic, more supple, more pliable. Polypropylene, margarine tubs, yogurt tubs, again, a little bit thinner than that high density poly that we talked about, number 2. And then last, polystyrene. This hopefully this should be banned, but it's not, because it's actually one of the most deleterious plastics that there are. Where are these microplastics coming from? So what you'll see on the far right there, it says macroplastics to become microplastics. So these are any number of different kinds of products that are breaking down in our environment, making their way into our soils and water, and then obviously coming back into our bodies. But also paint is a microplastic. There are microplastics being shedded from our tires every time we drive, and even personal care products. There's a lot of farming that occurs in Nebraska. If you drive around, you might see that there is a lot of plastic used in sheaths on the ground. Obviously, all of that plastic does break down. It makes its way into the soil, and then we eat that plastic in the plants that we consume. And then in addition, we've seen sewer sludge. So municipalities will take sewer, they will disinfect it, but then use that sludge to create fertilizer or soils that then we put on our crops. And unfortunately, those sewer sludges are concentrated for plastics and specifically for PFAS, or the forever chemicals. And we've seen that now in certain states, in Maine and in Texas, there are lawsuits because if a farmer's field gets so contaminated with PFAS that he or she can't farm, that's a little bit of a problem, because nobody warned that farmer that their land would become fallow due to this contamination. Interestingly enough, plastic exposure mirrors affluence. So the more money you have, oftentimes the greater the plastic exposure that you have as well, because plastics are correlated with consumption and the materials that we bring into our lives and our homes. So we as a nation produce more plastic than any other country on the planet. And then here, I kind of mentioned this at the top, but the global plastic market is currently 624 billion, and it's expected to grow to 876 in the next 5 years. And obviously, these fossil fuel companies know this, and so they're investing a lot in increased production of plastic. There is just a new facility in Texas that went online. How long does it take for this plastic to break down? You'll see some estimates there. So we're talking usually somewhere in the hundreds of years for the types of materials that we see in our everyday lives. And it breaks my heart, because we tell our patients and ourselves, to eat lots of fruits and vegetables, but, unless you go to a farmer's market, it's really hard to find, for instance, strawberries or blueberries or raspberries that don't come to the store in a plastic container. So microplastics in the air may be leading to increased rates of lung and colon cancer. This was a review study of 3,000 studies suggesting these air particles might be also leading to infertility. And so I put this slide together to kind of break down how these particles are entering our body and where they're coming from. Are they coming from the food we eat, from the air we breathe? And so what these studies showed was that, let's say you have a bumper day in terms of oral intake of microplastics. You drink a lot of bottled water, you have some fish or shrimp that have a lot of microplastics in them. And so let's say on that day you had 15,000 microplastic particles, and then you inhaled 13,000 microplastic particles. So that's a total exposure of around 37,000. And interestingly, indoor exposure to microplastics is about 8 times more than outdoor exposure. So what are these plastics doing to our health? Well, they are causing oxidative injury. They are causing inflammation. They are affecting our immune system. They're increasing our rates of cancer. They're damaging our DNA and our reproductive system. And this is based on over 7,000 studies. So if we look at where these microplastics have been found recently, we'll see that basically anywhere researchers look in the human body, they're going to be finding microplastics, even, of course, crossing the blood-brain barrier. So now what I want to do is I want to kind of separate a little bit some of the studies looking at the actual particles and those looking at the chemicals inside the particles. And so I brought up this graphic because I do think it's helpful to understand what size we're talking about. If you have the human hair there on the right-hand side, and then a grain of salt, you can see a white blood cell, and then all the way down, getting down to the Zika virus or the coronavirus there at the very end. So microplastic particles are anywhere from 5 millimeters down to 0.1 micrometer. So lots of different sizes of microplastics are in the overall term microplastics, whereas nanoplastics are those plastics of 0.1 or 1/10 of a micrometer or less. And you can see here, this is a picture of a plant stem that is pulling a particle of microplastic up its inner vascular. In addition, a lot of these chemicals are coming into our food. So we see that plastics are more likely to enter our food at higher temperatures after long contact times, in using smaller portion sizes. So oftentimes, baby food or children's food is packaged in plastic in smaller sizes. So unfortunately, that means greater migration or exposure of microplastics, and then also in fat soluble and fatty foods. So this was a study that came out just last September. They looked at 14,000 food contact chemicals and found that around 3,600 of them were migrating from the food packaging into the food. And of those, about 80 had hazard properties of high concern. So we're talking here about metals, volatile organic compounds, PFAS, phthalates, and phenols, or BPA. And again, high temperatures, high fat, and high acidity were found to increase the transfer of those chemicals into the food. So let's say we have a food that has a lot of plastic migration in it. What's happening at the gut interface? It is causing some dysbiosis of our microbiome. And as you know, the microbiome has been associated with more and more components of our overall health. So it affects our immune system. It can cause damage at the gut barrier, and then also inflammation of the gut. And, you know, again, I've seen over the course of my lifetime in practice an increased number of patients with IBD, IBS, celiac disease, and other diseases of the gastrointestinal tract. So these are some studies looking at the actual plastic particles. So on the left there, you'll see a study showing that those patients who had ischemic strokes, MIs, or DVT had higher concentration of microplastics in their blood clots, and that microplastics may be associated with increased disease severity. And then, of course, we saw that fascinating study coming out of Italy where researchers took the atherosclerotic plaques of patients who had them, looked at the plaques under the microscope, and found that patients whose carotid artery plaques had more microplastics in them also had a higher risk of MI, stroke, and death. I actually started a TikTok channel. I'm 57, and I started a TikTok channel just to talk about plastics and health. And I went viral with this study that it came out preprint last October, and then the peer-reviewed print was in February of this year, showing the accumulation of microplastics in the brain. And what these researchers did was they looked at some decedents in New Mexico that had no family. So these bodies were sitting in the morgue, and then they took their brains and looked at the number of microplastic particles in brains, and they were able to compare brains from 2016 to 2024. And what they found was that there was a 50% increase in the amount of microplastics over that 8-year period. And interestingly, the researchers were surprised to find that the brain had 7 to 30 times higher concentration of microplastics than the kidneys. They also looked at the liver as well. And so, you know, why are microplastics accumulating in the brain? Researchers think maybe it's due to the fat solubility, like equals like. But what they also were able to show was that some of those decedents who had the highest concentrations of microplastics in their brain also had concomitant diagnoses of dementia and Alzheimer's. So we see in this study that researchers took infant feces, compared them with adult feces, and the infants unfortunately had 20 times more microplastics in their feces than adults, and that is due to the nature, the manner by which exposures are more impactful. The smaller you are, obviously your body surface area compared to your metabolism, and then also how these exposures are affecting infants and children versus adults. If you see someone microwaving their food in plastic, you should be a good Samaritan and mention that in 3 minutes, around 4 million pieces of microplastic particles will be released into that food. And remember, we showed that on a maximum day, the researchers didn't probably include microwaving your food in plastic, but that was around 37,000 particles. Plastics, unfortunately, has also been found in breast milk, polyethylene, polyethylene tetrathalate, and nylon. And then researchers are also, of course, looking at placentas. So in this study, 62 placentas, and all of them were positive for microplastics, polyethylene predominantly, but also polyvinyl chloride and nylon. This study is still in preprint, but basically researchers hypothesized that the longer a woman was pregnant, the more microplastics we would find in her placenta. But what they found actually was the opposite. They found that there were more microplastics in those women who gave birth preterm. And here were some of the microplastics that they found. Interestingly, they found the microplastics were 122 times higher in the placenta than in the blood. They, we're not talking about causation, but I hope that this is appropriately disturbing to you as it is to me. As we know, rates of preterm birth are going up. So why are plastics more important for mothers and therefore also for babies, especially in utero? Well, it's because the child's chemical exposures are greater pound for pound than for adults. Children have a more porous blood-brain barrier, so there's more brain exposure in utero and in early infancy. Fetal organ systems are rapidly developing, so they're more vulnerable to damage. The systems that detoxify these chemicals, the livers, the kidney, are not as fully developed. They have a longer lifespan, so they have greater chemical burden. And all of these chemicals cross the placenta. They also note that these chemicals are cumulative and that we don't yet know whether some of these chemicals potentially interact with each other. So this was a literature search that I did showing all of this data really has happened in the last 10 to 15 years, right? We've just started studying the effects of endocrine disrupting chemicals on children's health. And I won't go through this entire graphic, but it is a really good one if you want to refer back. And these are the actual cellular mechanisms and ways that these endocrine disrupting chemicals in our plastics are affecting our bodies at the cellular level. They're interrupting signal transduction, receptor expression, hormone breakdown and clearance, as well as DNA synthesis. And then importantly, some people might imagine that these endocrine disrupting chemicals, the more you're exposed, sometimes, the greater the effect. But actually, endocrine disrupting chemicals are what are called non-monotonic. So sometimes the smaller doses are having a more profound effect physiologically than higher doses. This is just a graphic kind of demonstrating how the sources of these endocrine disrupting chemicals are food packaging, our personal care products, the chemicals contained within, phenols, PFAS, phthalates, are then affecting our pregnancies with increased rates of gestational diabetes, preterm birth, loss, and fetal growth restriction. This is an umbrella review that was published last year. So an umbrella review is a meta-analysis of meta-analyses. I actually hadn't come across this before. So here they were looking at microplastics, endocrine disrupting chemicals, flame retardants, and what they found was that these chemicals increase the anogenital distance in girls. We've seen other data showing it increases it in boys, and that could be having an effect on diabetes, PCOS, obesity, and hypertension, and cardiovascular disease. So lots of information in this umbrella review. As someone who cares for women, there has been data to support that these chemicals may be associated with increased rates of endometriosis, the formation of fibroids, as well as polycystic ovarian syndrome. And that makes sense because obesity, diabetes, and insulin resistance all of a piece. This study just came out last month showing that microplastics were found in the follicular fluid surrounding eggs in the ovary. So let's talk a little bit about each individual chemical. So phthalates are in all of our medical supplies. They are in all of our IV bags and all of our tubing. They make plastic flexible. In addition, phthalates hold a scent. They're used in a lot of cables, flooring, adhesives. Phthalates mimic estrogen. They disrupt thyroid and they lower testosterone. They function as an obesogen, and they are present in all of our bodily fluids. And they may be responsible for increasing miscarriage, insulin resistance, early puberty, child and adult cancer. And then phenols. So phenols are the chemical you're familiar with. These are the chemicals that line all of our food cans. They also mimic estrogen, disrupt the thyroid, and lower testosterone. They bind to estrogen, testosterone, thyroid, and glucocorticoid, and they may be also associated with some of the disease processes that we've been talking about there. And then PFAS or PFOS, these are the forever chemicals. They are also responsible for decreasing testosterone, disrupting thyroid, interfering with fat cell differentiation and lipid metabolism, so maybe also contributing to our obesity epidemic. And nearly every individual is positive for PFAS, so no randomized controlled trials here, given that there is no one that doesn't have this chemical in their body already. And then lastly, parabens. These are in a lot of our personal care products, also mimicking estrogen and reducing fertility, may be associated with breast cancer. So let's look at some individual studies here. So the one on the left, of 10,000 studies, 30 met inclusion criteria showing prenatal exposure to these chemicals may increase the risk of obesity in children. And the one on the right, systematic review and meta-analysis showing PFAS and phthalate exposure may be linked to increased preterm birth, small for gestational age, and miscarriage risk. The one on the left is also a systematic review showing seafood consumption and bottled water were associated with more microplastics in amniotic fluid in pregnant women. And the one on the right, a meta-analysis showing that PFAS and phthalates were associated with gestational hypertension. So here was the answer to the question that I had at the beginning of the talk: why are my patients being diagnosed with hypertensive disorders at greater frequency in pregnancy? Two important studies here linking prenatal exposure to phthalates and preterm birth. So in both of these studies, what researchers did was they looked at the urine of pregnant women, and the urine and in the urine, researchers can measure the metabolites or the breakdown of phthalates in maternal urine. And so what they were able to show was that those women who had the highest levels of phthalates in their urine also had an increased risk for preterm birth. And then this was a paper that I published recently with some others at my institution. And this was a scoping review, and we showed that phthalates, PFAS, and pesticides were associated with preterm birth, small for gestational age, and miscarriage. Lastly, this study showing exposure to phenols increased the risk for preeclampsia, as well as smaller placentas and intrauterine growth restriction. Unfortunately, when you see something on a product that says BPA free, what the chemical companies have done is they've replaced BPA with BPS or BPF. So the chemicals haven't disappeared, and sometimes the substitution is more deleterious than the original. I wanted to see if there was data about NICU exposure to phthalates, because babies in the NICU have a lot of medical equipment and tubing surrounding them. And sure enough, there are supraphysiologic levels in some of these studies of babies being exposed to phthalates. We know phthalates also have the potential to decrease fertility. And this study showing that the phthalates in the plastic toys in the Happy Meal the government outlawed the addition of phthalates into the toys in the Happy Meal, but we're still seeing phthalates in the actual food. So this was a study looking at fast food, and they found that all food samples were positive for phthalates. talk a little bit about PFAS because it is such a huge class of chemicals and it is so ubiquitous. So this was a study of PFAS in pregnancy, and of 302 participants, 97% had maternal blood and umbilical cord blood positive for PFAS. This study, looking at women trying to get pregnant, those with the highest levels of PFAS had a 40% lower chance of becoming pregnant. And then PFAS, there are some state legislative initiatives to ban PFAS from being purposefully added to some products. So you can actually go and look up and see whether Nebraska has passed any bills protecting its population from these chemicals. You can also go to this is the Environmental Working Group, but there's also another, well, the EPA might not have it anymore because they've been scrubbing their website of anything that might put the plastic chemical companies on notice, but you can determine whether or not there are areas near you where water is contaminated with PFAS. So really the challenge to reducing exposure to these chemicals is because they're not tested prior to being sold on the marketplace. There are no disclosure requirements that these products could be harmful to us. 94% of chemicals and pesticides in the U.S. have no requirements to test for human safety. The lobbying efforts, I mentioned this, weaponizing scientific uncertainty to foster distrust. So the people who say to me at the end of my talk, well, you haven't proven causation. And the fact is that there might never be a causative study because studying these chemicals really can only be done in observational studies, in part, obviously, because we can't knowingly expose a population to these chemicals like we do with a pharmacological study where we have a control group and an exposed group. In addition, environmental medicine isn't required for a lot of healthcare curriculums. And then really importantly, there's insufficient time in a workday of a healthcare practitioner to really take time to understand what exposures our patients might be having. Having said that, there are some good resources with the American College of OBGYN as well as the American Society for Reproductive Medicine. So left to us, left to the individual, what can we do? Well, in terms of climate change, you can look at your index risk for your state. You can conduct what's called a life cycle assessment. So this is where you take one thing, and in this case, researchers took hysterectomy, and they looked at how many carbon emissions were associated with different types of hysterectomy. And as you can probably not surprised, robotic hysterectomy had the highest amount of emissions, and vaginal hysterectomy had the lowest. The operating room is a great place to try and decarbonize. It uses 3 to 6 more times energy per square foot than anywhere else in the hospital. You can move to reusable instruments in the operating room or the emergency department. This study I thought was fascinating. This was a single 250 milliliter IV infusion, and they showed that over the course of that infusion, it released thousands of microplastic particles into the bloodstream of the individual. You can become a team leader, a steward for exposure to plastics and environmental emissions. This was a study showing that reusable surgical drapes versus disposable, there was no increased rates of infection with reusable drapes. In my area, in obstetrics and gynecology, using those plastic speculums is 4 times the carbon emissions as using the metal speculums. Importantly, healthcare is 4 times emissions of aviation. So one robotic surgery is the equivalent of driving around 150 miles. This study just came out last month showing that potentially 4 to 26% of our imaging studies are inappropriate, that is to say not clinically indicated, and that those excess emissions are enough to power 70,000 people for 1 year. avoiding some of these single-use disposable instruments. We see, medicines in blister packs. There's no reason that pills need to be in a blister pack versus a container. Everyone in our industry in healthcare could be part of the solution. Our cafeterias are also places where there's a lot of carbon emissions. Around 20% of a hospital's emissions come from the cafeteria. We can move to a plant-based diet. I know I'm saying this in Nebraska where a lot of meat packing occurs, but plant-based diets obviously have lower carbon emissions than meat, as well as decreased exposure to some of these pesticides and chemicals and antibiotics in the food. Not microwaving food in plastic, especially in black plastic. Why do I talk about black plastic? Well, there's not enough black plastic for all of the uses that it has for consumers. So they do recycle some black plastic, and sometimes what they recycle are black plastic that is electronic. So if you look at your iPhone casing or your computer casing, that black plastic can make its way into food grade black plastic. And unfortunately, a lot of electronics have flame retardants added to them. And so there was a study. She did have her math wrong. She had to make an amendment to the study last October. Having said that, there still is PDBEs or flame retardants in black plastic. All of our hot cups are lined with plastic. You'll see a lot of tea bags are made of nylon. This releases over these types of tea bags release billions with a B pieces of plastic when you steep them in hot water. A lot of the dishwasher and laundry detergents are made now with these polyvinyl alcohol. So this plastic dissolves in your dishwasher or washer, but all of that plastic goes into the waterway. And then, of course, you end up drinking that water with the plastic back in it. A lot of the single serve coffee filters, Keurigs, these all are lined with plastic as well. Air fryers with nonstick coatings. Those nonstick coatings are all PFAS. Sponges are a source of microplastics. The Teflon and even some of those ceramic coatings also have plastics in them. And then even paper plates are lined with a thin coating of plastic on them. You'll notice that oftentimes your paper plate doesn't get soggy when you put food on it. That's because it's lined with plastic. Microwave popcorn, these bags are lined with forever chemicals. Baby bottles, unfortunately, if you have patients who are bottle feeding, recommend that they use glass or silicone. I personally have a water filter that sits in my refrigerator like this, and it does filter out plastics, including PFAS. Some of the dental flosses, like Glide, is made with or lined with PFAS. This study came out just a couple months ago showing that an hour of gum chewing released 250,000 microplastic particles, as gum is made of plastic. Watch out for fast fashion. Most of this clothing is polyester. It breaks down quickly, and all of that polyester plastic goes into our waterways. Here are some great resources, some books that are discussing the plastic crisis, and some documentaries. Plastic People just came out a couple of months ago. You can join me at OBGYNs for Sustainable Future. I have some webinars here where I interview thought leaders who are talking and researching on this subject. And then we also recently formed the Physician and Scientist Network addressing plastics and health. We're just getting going. It's physicians of all specialties, but also researchers in this area. And our goal is to get the message out. I'm producing a 2-pager or front to back that hopefully we can hand out to patients who are pregnant, because they and their babies are more vulnerable. And that's my talk. Those are some of my publications, as well as my socials, if you want to DM me. So I'll open it up for questions.
What do you suggest people do to minimize plastic? I mean, basically you listed all products that we're using all day, every day.
Yeah.
Feels almost hopeless. Besides using a tin cup all day and cooking in cast iron, what do you suggest?
Well, researchers who also talk on this. I was just at a plastic symposium. The three big ones I would say that I hear repeated as well are not to microwave in plastic. So replacing your food storage containers that are plastic with glass. People say, oh, well, that's really expensive. Actually, it's not. You know, if you go to any Goodwill, you'll actually see older people have oftentimes a lot of glass in their homes as opposed to plastic. And so you can find these types of storage containers as well at Costco for not too much money. So replacing your food storage with glass and then not, of course, ever microwaving anything in plastic. And that includes frozen food. You'll see frozen food that comes in a plastic tray, and it'll say, obviously, that you can microwave the food in the tray. You can't. You shouldn't. You should take frozen food out of those trays and heat it in the microwave in a glass or ceramic container. Number two would be the beverages. So that's all of the Gatorade, Zero Water, your Diet Coke. Unfortunately, if it's an aluminum can, it's lined with plastic. If it's in a plastic bottle, of course, you can see it's plastic. The problem with both of those is that they're both leaching thousands of microplastic particles into that beverage. What we don't know is the temperature in the warehouse where that beverage was stored, the heat, potentially adding microplastics to that beverage before we get it and it's nice and cold. So I have just stopped drinking out of aluminum cans or plastic bottles. And researchers talk about that as well. And then, in terms of cooking.
What do you do? Your milk comes in a jug. Aside from water out of a tap, nothing is without a can or a flask.
Well, I think, you absolutely, if you want to, it's normal to feel like this is overwhelming. Like I feel that too. Having said that, you actually can take steps to limit it, to mitigate it.
Okay.
So I just told you I don't drink out of cans or bottles anymore, but you can if you feel like you're overwhelmed and you don't want to do anything, but you asked me what I would do. And then the other thing, given that there is 8 times the amount of microplastics in the home versus outside, researchers talk about doing like mopping with a wet cloth more frequently to cut down dust, having a HEPA filter as well. So, the people who are most vulnerable are pregnant people and infants. So being able to protect them will have the greatest effect. Those of us who are older, obviously, our exposures are baked in, as it were. But how can we protect those who are most vulnerable? But if this makes you angry, then, join us in our crusade. These chemical companies are very powerful, that's why I put that at the top and kind of remind you throughout that we should have a society where we are protected from these. And the only people that can really hold those companies accountable are our elected officials. And so who we vote for actually matters.
Thank you.
Any other questions?
Again,
Thank you.
I want to thank you for your time and expertise. Attendees, thanks for coming.
That concludes the online education. I would like to thank all of our presenters for their experience, knowledge, and expertise. Be sure to subscribe so you're up to date with all of Nebraska Methodist College's continuing education offerings. Thank you.